Yes, hello, Dr. Sanchita. How are you?
I'm fine. And what about you?
Yeah, I'm good too. Thank you. And many congratulations on passing
Thank you.
MRCOG. It's you must be feeling very happy. And
Yes, you know that
yes,
because you also go through this.
yes, of course. Of course. And when I got your message, it was like I was really very happy to know that you have passed. And
Because you know that last time I just missed it
Mhm.
only for 2 months. And it was a horrible experience not to pass when it is too close near to the pass mark.
Yes, exactly. And I know you were very close, and then I had that faith in you, like that you will do it this time. And when I got your message, it was really like I was really very happy. Can you tell us about your preparation so that this will help other colleagues? I mean, how you started and what people should be doing, like even for those who are preparing, who are repeating the exam, for them also it's a bit difficult.
Okay, first thing is that don't lose faith in yourself and also at the of our Almighty, because at the first time we had to believe in our strength. We know that Almighty is with us, but before that we also have faith in us, because you know that it is a long and tiredness journey, and I am almost 50. I'm proud to say that I am almost 50, but at this
Yes.
age of at this
Mhm.
age, if I can do it, the younger colleague who are more younger than me, they are I can see that most of the colleagues are 10 to 15 years younger to me. They are just starting their career, but at this stage, if I can do it, I can tell you that every can do it. Just hard working is only the thing. We have to do not lose the faith, because the syllabus is too big, and there is
Yes.
no limit of syllabus. We cannot know what will come, what will won't come.
Yes.
Yes,
Exactly.
and at the same time, in the second part, though it is also a vast one, because it is the reflect of the second part. But in the second
Mhm.
part, we can think, because we have time to think. But in
Yes.
this step, go of all 14 stations at a row. I think it is a roller coaster journey, and I also can see that we have not to think about what we have done wrong, because when the ring is or bell is rang, we have to rush to the second station. And I
Yes.
think, and I think that there is no time to think what I have done in my previous station, but we have to grip on the and at I'd also like to tell my newer colleagues who are trying to prepare, who will for the first time or who have failed this time, don't lose hope, because we have not to do correctly every 14 stations,
Yes,
because
exactly.
because huh,
Mhm.
because I would also like to tell you that our knowledge is just against 5 domains. Though I get 78% number, but I would like to tell you that I can't clear the applied knowledge portion,
Yes. Hmm.
because we have not to, and don't focus on this thing that I have to clear all 5 portions. I have, though I get 78%, it is not a it is a good one, I think.
Yes,
Marking
it's
is
very
a
good. 78% is, yes, yes,
it's
it's
a very it is a good
yes,
one. But
very good.
though that but when I heard my result over telephone, I have not that courage to open my uh, result. And
Yes.
always I think
Hmm.
that when I myself open my result, it is not good for me. That's why my lucky charm, I always open my
Okay.
result by my child or by my husband.
Right.
And when they open the result for me, always
It
bring
is.
the good result for me.
Yes. Yes, it is.
and,
Mhm.
and I also get your message that time. You have give us a message on our group that please, result has released, but you will wait for the later one, because
Yes.
when the result is delayed, result is good one.
Yes, I always say wait for late result because late
Yes,
result
yes, ma'am.
means pass.
When my I am going for my chamber, and that time I cannot yet receive that mail. Already it is
Mm-hmm.
6 in Bangladeshi time. In the UK time, it is only about 2 p.m. That time I was I was
Okay.
believing that I will pass,
Yes.
because all over the country I only heard the result is no, they won't pass.
Mhm.
They got they smart, they won't
Yes.
clear the exam. That time I have a courage in my mind that
Yes.
I may pass,
Yes, yes.
because
Because
I yet not get the mail.
if your result is delayed, it means that it's a pass result. Yes.
Yes, ma'am. That's the
Mhm.
true. I
Mhm.
got my result after 1 hour, 1 hour
Yeah.
like that,
Yes.
and that times it came to my mind that I will pass. And I would also like to tell that this
Yes.
fail will bring us a courage that I can do. If you get a poor number this time, don't lose your hope, and
Right.
don't think that the you are not able to pass the exam. It is
Mhm.
doable. I can say that if all of my colleagues, that it is a doable exam. Only that is need, that is our consistent. You have to not to lose any time.
Mhm.
Start prepared from the coming day.
Right.
Start with one station. Not do go with the at first. Not go with the tough one. First with the easiest one. You
Yes.
will go with the easiest one, and that will give you the courage that
Yes.
I can
Yes.
do. And when by the day will pass by, then you will grab to the toughest station. Then that will burst. Don't go. I'd also like to tell that from the part second part and course, we can also say that there are some common station which are Susie
Mhm.
re- really like. They
Yes.
don't go out of that, like postmenopausal bleeding, like something like endometrial hyperplasia,
Yes.
like endometrium cancer is their favorite topics. No exam will not go without endometrium. I from the previous exam, and from now, those who are appearing for the first time, for them, but your course, you Shabana, you cordially do the labor ward prioritization. I would like to tell you that, ma'am, is it possible
Mhm.
in your curriculum to do the labor ward prioritization from the first day? Because you know that this is the station which everybody should
Yes.
pay for this.
Yes, yes.
you do
Definitely, it
you
will be
do
there. Yes.
you do a good job that or other mentors in some like that what happened that everybody won't able to present a labor work prioritization, but you did by all of your students have to do the labor ward prioritization pre-operative round and
Yes.
gynae ward prioritization.
Mhm.
But I would give you a small suggestion. It is not my, I won't give you
Mhm.
any here, but I would like to tell you that
Yes.
if you do the labor ward prioritization from the first forward, then they will get a lot of time to
Right.
practice it.
Yes.
I think so, because we have a phobia about labor work prioritization. Though this is our daily work activities, but we get haphazard, we get puzzled what we should do when we saw lots of station at a glance.
Yes.
If you go through the, and I would also like to tell you that Shabana, your teaching module is excellent. This is a vast one, and you have started it from the first. And if you after the teaching module, I would like to tell you that don't take it otherwise. If you do the labor
Mhm.
word prioritization, I think that that will be also helpful for us, but
Right.
because
Yes.
uh,
Yeah.
because other modules are more or less and the best thing is that from your class and your year, you provided all the materials to us, and this is a great help, because in other from the other mentors, you know that all of us go through here and there
Yes.
not, yes, it is
It
a
is,
open things
it
now,
is open
but
thing. Yes.
because
Mhm.
but what is appreciable for you, that is you provide us with the our reading material,
The
that is
PDF.
you provide yes PDF
Mhm.
form, and
Mhm.
that that is not no any handwriting, not any students conversation. After the class you have to put all things in the pdf form in a clear note, and that is a great help for us, because it is a easyable way we
It
can
helps in revision.
yeah,
Yes,
yes
yes.
ma'am, it helps in a
Mhm.
revision in a great way. And you also give us a listening material, that would also help us to prepare us. But when we will prepare us, we can and also compare it with the reading material. That is the best thing I can tell about you. And at the same time, I would also like to tell you that you don't take a crowded class, that someone is listening, someone is one to one. You When you take our class, there's this one to one active participant we present in front of
Mhm.
you, and you will also give our feedback. And then in that is a great thing, Dr. Shabana. Your
Yes.
course is more than enough. I would also like to tell you that. But I'd also like to tell that, please, if it is possible for you, because I can see that you are also too much busy. I can see that. And then if you can get the labor ward prioritization in a earlier part,
Yes,
that will be
I
helpful
got
for
it.
that.
Yes, actually, my idea was, yeah. My one thing is that I always made sure that every student, every candidate has to present labor what, because
Yes, ma'am. That's
there is,
the great thing.
yes, because
Yes,
we
ma'am.
all know
Mm.
it is
Mm.
one question which is an open question
Hi.
in exam.
Open question.
It
Yes,
will be
yes, ma'am.
definitely there. Yes, yes,
Every student will have to face the
yeah,
labor
yeah,
word prioritization in
yeah,
the
yeah.
4-day examination.
Mhm.
And ma'am, you
Yes.
also told me once upon a time, in my first time, when I asked
Uh-huh.
you that
Uh-huh.
about the center, you told me
Yes.
that center is not a problem whenever a
Mm-hmm.
student pass from that center. But ma'am, I don't know, because as this is my second attempt,
Mm-hmm.
I will tell that sometimes centers matters. I think that it is my personal opinion
Okay.
for my upcoming colleague, because you know that MRCOG Part 3 is a huge investment. It is not only the monetary investment; it is our time, our family. All things are
Mm-hmm.
engaged in a row. I will say that, ma'am, this time, as I appeared from the Singapore, this is a excellent center, ma'am.
Right. Yes, yes. I heard
Yes,
from some other candidates also that role players were also very kind. The
yes,
examiners
ma'am.
were very
Yes,
polite.
ma'am. Yes, ma'am.
And
Ma'am, I would like
mhm.
to tell you one thing, that you know that in our teaching station there is shoulder dystocia.
Yes.
Shoulder dystocia is not a common station, but we have somehow prepared it, and that much I also don't practice it. No,
Mhm.
don't know. In the one day before, in the 18th June, we are
Mhm.
four girl at a group mate. We
Yes.
prepared that. We At the last time we revision all the teaching station.
Yes.
Because all of them are for all together. We have
Mhm.
to, but a proper station we can one to one we can that time. But you know that for the stress of the examination, I forgot the incident reporting. The role player is so
Okay.
good, a young male person. I can also remember his name. He in the role player, his name is Khans. He's so much euphoric always. And that time I have told him everything, what is shoulder stitch, how it was diagnosed, what the maneuver we have to do. At the
Okay.
last time, I have forgotten to mention the incident reporting. But that time he told me, shall I report anywhere? And that time
Oh,
it
right.
starts our mind that
Mhm.
we have to do the incident. And in that way, in every way, they
Yes.
help us a lot, ma'am.
So you
They
got a
help
hint.
us.
Yes, you got a hint from the role player. Huh.
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Mhm.
And I would also like to another station that we have a station. You know that primary with 36 weeks of pregnancy, she wants to go for the cesarean section, and I have to mind it that it there. Of course, there is a hidden agenda why she is going for the cesarean section.
Mhm.
Then and I am, and
At
that is a
36
small.
weeks. Yeah.
At 36 weeks, and this is a
Mhm.
very small reading material. Primary 36 weeks pregnancy, she wants to go for the cesarean section, and I have to make in mind that what is the pros and cons of the normal delivery, what is pros and cons of the cesarean section. I
Mhm.
am I know I will like to find out the hidden agenda. But unfortunately, during the exam, when my role player conversation came, I
Yes.
forgot to ask the medical history, and that is the patient
Okay.
safety point, because
Right.
patient have Crohn's disease.
Right. Okay.
And yes, and that's why patient does not want to go for the vaginal
Vaginal
delivery.
birth.
She
Yeah.
she
Mhm.
knows that there may be a probability of the episiotomy, and
Yes.
we also know that if has the there is the form of the sinuses, fistula will be there. And I don't know how I forget to take the medical history, but she promised me that I don't want to go for the vaginal
Mhm.
delivery because there is a possibility of cut.
All right.
I don't
Mhm.
want to go for that cut. And that time, it strikes my mind that she must have any medical problem or Crohn's disease because I don't know
Okay.
why RCUG is very fond of Crohn's disease.
Yes.
Every,
Something will be there. Ulcerative colitis, Crohn's
yes, ma'am.
disease.
So,
Mhm.
they like of this because you know that we have also, that's why I
Molar
have
pregnancy
that.
with Crohn's disease.
Yes, ma'am. Molar pregnancy with Crohn's
Yes.
disease. Every time
Yes.
they put this in the their
Yeah,
station,
they
and
want to
that's time.
listen. Maybe that you will be involving the MDT. It's going to be shared care.
Yes, ma'am. Yes, ma'am.
So
Yes.
that is also
That's why
interesting.
I at that time it strikes my mind, and I have
Yes.
asked that I have forgotten blood. I'd like to know your medical history,
Oh,
ma'am. I would like to say that the role player is excellent.
yes.
They
Mhm.
try to their try was to pass us. You know that,
Yes.
ma'am, that you also know that, ma'am, in our day 20th,
Mhm.
we appeared at the evening station. There are lots of
Mhm.
Bangladeshi.
Mhm. Mhm.
We are one, two, three, four, five, six Bangladeshis in one group.
Right. Okay.
No, six, no, okay, no, seven Bangladeshi. And
Okay.
for the blessings of Almighty, all of seven
All
Bangladeshis have passed.
very nice. All right. Very good. But you people are very hardworking also. I have noticed
No,
that.
no, ma'am, you know that all of them are hardworking. Who will
Yes.
take the stress of this exam, ma'am?
Yes.
I've already told you this is monetary involvement.
Mhm.
I have also there is familial involvement because for me, my family also suffered a lot.
Yes.
At the
Right.
last time, I'd all time scold my girl when she come closer to me. I will go, I go. I have no time to talk to you, and all time irritated. That's why you know that better, ma'am.
Yes, of course.
And
When
of
you're
course, that
going,
is. Hmm.
mhm, when
That's why, ma'am, I will recommend that center choose is also, ma'am. I don't want to disobey you, or I don't want to say
it's
anything. Don't respect you.
yes,
But
yes.
if I have gave two exam in two different places,
Mhm.
but I will say my colleagues. If they want to go for that, I will always suggest them to go for the Singapore or UAE. I think so, ma'am. It's my
Right.
what
Mhm.
I have experienced. I want to share it because I
Yes,
don't want to any of my colleagues should suffer.
yes, yes.
Yes,
Right.
I want that they should come out with at the first attempt with flying
Mhm.
colors
Yeah, yes, yes.
because
But the
you know that,
seats are
ma'am.
also very limited, and
Mm.
getting a seat itself is a competition, you know.
Yes, ma'am. Yes, ma'am. Getting a seat, you know that money. I would like to tell you that being giving the examination, but getting a seat is more difficult than giving examination.
Yes, it
But
is
you
a
know
very
that.
stressful time.
Yes, ma'am. In a blink of eye, you know that, ma'am. I at this time for our four, we are four partner. You already know that Tanya Islam Chaudhuri
Yes,
also, yes, she
yes,
also passed.
yeah,
We and two other our star partner. We four sit together to
yes.
form fill up.
Mhm.
But at first, I go so quickly. I got the seat for the Singapore, but my credit card payment is rejected, and when rejected there is no seat, and on that time all of my three partners got seat, and that is also a stress for me. And I think that I won't be able for go for the examination. But
Right.
all of a sudden I don't lose the hope. I stay at the computer, and after 15 to 20 minutes, all of a sudden one seat is released in the Singapore. And I
Yes.
grabbed that set. And this
Yes.
is another advice from myself to my colleagues who will appear the exam. When
Yes.
you see that there is no seat, don't lose your hope. Believe in God and stay. Because sometimes what happens, sometimes due to some credit card section transaction, there's sometimes the seat are released and you have to wait for, because 1.5 an hour or more than 2 hours, there are sometimes what happens, seats are released then.
Yes.
But
Yes.
all in the
You're right.
first time when all of us are rushed together, that times it is difficult to get the seat.
Yes. Yes. For
Yes.
booking also, you need lot of patience.
Yes, ma'am. Booking is
Right.
also a lot of patience.
Mm.
And you know that in our country, because of now our political condition is a little bit unstable, our
Mhm.
credit card payment is difficult. We have to face it more problem than other countries also, ma'am. But
Yes.
at last, I would also like to that Dr. Shabana is an excellent mentor. Though she is also busy, but she,
Thank you.
whenever any query, she gives that query answer. I think I also saw that, ma'am. I have also asked that from which module I will get it. You then and that you send me. Go there and you will find it. And this is a great help, ma'am.
Mhm.
On that time, money. On that time, it is a great help, ma'am. That
Yes.
because I was searching one by one module. You know that some modules are common, like
Mhm.
antenatal module and maternal medicine. Some money
Yes.
infection is here and there. But whenever we asked any question, you yourself tried your best. And we have also asked you, ma'am, what you will get. We have prepared it not, then I think that then you have some hurry to get that PDF ready for us, and you think that, and I have mine that I will also keep that. Ma'am,
Yes.
I from the bottom of heart I also pray for you, that this
Thank you
is
so
a great
much.
pleasure for us, that mentors like you is a really grateful for us. And
Yes.
I would also like to tell you that when I have failed in the last November exam,
Mhm.
I don't have to pay any extra money for the extension
Mhm.
of your course. This is also a great blessings for us, ma'am. You know that because if any material will not have us, it is difficult for us to
Yes.
revision of the course, ma'am.
Exactly.
This is also a great help for us. It is a kind of humanity, ma'am, that you don't ask a single penny for us. That
That is because we are all colleagues after all. I mean, even I feel happy when I see all of you pass because it's your hard work at the end of the day, like failing one time and then again preparing. I mean, you got the shock of your life and then you are
yes, ma'am.
getting up again and then you're preparing. It 2 weeks will go in that. You will feel sad. I mean, there will be mixed feelings. I know that.
Yes, ma'am. Yes,
But
ma'am. Yes, ma'am.
so, yes, so like that is
And
like,
ma'am, I would also like to tell that, but because this MRCO exam, who does not appear this exam, they doesn't know what the exam means, because
right.
it is the
Mhm.
totally different from all other exam of the world. Because I have also a graduate student in my country also. That is also a
Mhm.
tough one. But this MRCUG is a really different one. It
Yes.
doesn't match with
Mhm.
any other exam.
And clinical is totally different. For
Yes,
the
ma'am.
clinical,
Yes.
your preparation should also be different from your part two.
Yes, ma'am.
And
Yes,
I
ma'am.
think practicing, this is what we always say that practice, why we say practice, so that you don't have to think in the exam. Everything will come
Yes, yes, ma'am.
spontaneously, isn't it?
Yes, ma'am.
Yeah.
Ma'am, this time what happened? You saw our question.
Yes,
You know
yes.
that. This time, our some of our scenarios are too short. But sometimes what happened in the last time, ma'am, the scenarios are too big. That time we have to just read it, sit, and only to gor, only to vomit it out,
Okay, okay.
and no money. That's why we have to grab over whole the module.
Mhm.
And I'd also like to tell my colleagues that you have to uh, prepare yourself like a basic preparation, that in maternal medicine I have to ask this, and all should have we have a basic template. And if we follow that, I can see that we cannot miss anything.
Yes, exactly. Because uh, talking helps because,
Hmm.
and
Yes, ma'am.
reading
And
better
and
information,
because our first
yes.
language is not English, I
Mhm.
think that part second part and part one, first part can do without partner, but for the third part there should be one partner only, not to read, only to practice.
Only
What
to
we should say,
practice.
practice.
Exactly. Yes,
What?
yes.
Yes, yes, ma'am. Because
Mhm.
when I can read, I know that I can tell everything. But when I go for tell, then I can see that I have missed a lot of things.
Yes.
And when my colleague will give feedback, then I can see that yes, I have missed this one, and then that time I can correct myself that yes, I have missed this one, or this is my shortcomings. Because you know that, Shabana, I have some
Yes.
problem with my speed, and you also told me, and you know
Yes.
that.
Mhm. I always
Dr. Rana may, yes, ma'am,
like that,
yes,
slow
ma'am, and
down.
Dr.
Don't try to speak a bit clearly. Don't rush.
Yes, ma'am.
Never rush.
Natasha,
Yeah.
never rush. And Dr. Rana May, she also told, and I have to only word this, that I have to
Mhm.
manis, speed, low down my speed. And for
Yes.
this, I engage my husband to know the others
Okay.
recording, how they speak. And he, I also, though he's not a medical one person, but I tell him, you don't need to understand anything. You just observe my speed,
Yes, whether he's able to understand what you're
whether
speaking.
he is able to understand, and
Exactly.
with
Whether you're speaking clearly, your speech
clearly,
is
yeah.
understandable.
The bell.
That is also important. Yes.
তবে but Dr. Shabana, this is um, a mind blowing experience to passing the and to grab this
Course.
degree.
Of course.
I know that this degree does not value anything in our country, but this is my personal happiness
Of
that I
course, it
have
will give
grabbed
you a
that.
satisfaction. Yes,
Yes, ma'am.
for you, for the
Uh,
personal satisfaction as well.
yes,
And
ma'am.
yes, of
And
course, it will definitely make you a very good clinician.
yes, ma'am. And
Definitely.
I think that it is open up my thinking, because
Mhm.
when I see my patient, my mind is open up. There is lots of differential diagnosis, and most of thing it help us for the authentication of the medical practice. But because when we know the right thing, uh, we do the right thing for the patient.
Exactly. Very well said. When you know the right thing, you do the right thing for the patient. Exactly. Exactly.
Because the knowledge is that thing in the, not only enlighten me,
Mhm.
but
Yes.
this will also enlighten the other people also. When
Yes.
I will properly utilize my knowledge, I think that the ladies who are all around will get also the
Mhm.
benefit.
Yes. Yes.
And I'd
That's
also
what
like
we
to
need.
tell that I'd
Mhm.
also like to the my colleagues who are going to give the examination for the first time, or who will are not able to clear this time, don't
Mhm.
lose their head. And I will also like that Dr. Shabana is a very well to do start with, because at first we are in a middle of a sea. We don't
Mhm.
know that where there is where we go to, because MRCOG part 3 examination, when we will go for the course, we will only see the tip of the iceberg, but the hidden portion is the vast one. For Dr. Shabana's course will help you, she will guide you. And whenever there is any problem, we will also personally message you, ma'am. You will also
Mhm.
respond to us immediately whenever it is possible, because you know that the different students are lives in the
Yes.
different time zone,
Yes.
but you replied us as soon as possible.
Mm-hmm. Yes,
Yes, ma'am.
and in the end, I think you or someone asked me for this malaria station, and then I
Yes, ma'am.
said that I have not prepared yet, and I will prepare
Yes.
it when I will get the time. And my God, I used to say, my God, I have not done my homework yet. It is my
Yes,
homework.
yes, ma'am. Ma'am, I would also like to tell that please extend your course, take more students. It will be more helpful to for us, because in regards to other mentors, your
Yes.
expense is also less. and it will be helpful for money for everybody. And I will also tell for the newer
Mm-hmm.
student that Dr. Shabana is a well mentor. She is a good mentor, and she will guide you in a right way. And her reading material is a great help for us. Is a great help for us,
Yeah,
ma'am.
thank you.
And I'd also like to that from ma'am, from the bottom of my heart, I will also like to thankful to you, and
Yeah.
I will also pray for your good health and good
Thank you
growth.
so much. Thank you, Dr. Sanchita, for these kind words. And thank you so much for coming and giving your precious time. It's not easy taking out time from your busy schedule. I mean, we are
No,
working
no,
in
no,
different
ma'am.
time zones.
I
So,
know that when I failed, you give me courage to come back, and I'd also like to
yes,
do that because. But and I'd also like to tell you that, please go through the syllabus by your heart. You have
yes.
to grip
Recalls
the
are very
syllabus.
important. What
Yes,
I
ma'am.
have,
Recalls are very
I got
much
the
important, ma'am.
feedback this time also that
Yes, ma'am.
90% were
You know
recalls
that, ma'am.
with some
That they are,
twist.
yes,
Mhm.
in these times there is stations with new stations, examination with new station, but
Yes,
it doesn't that if we do not good with the new station, that doesn't matter, because new station is new for all of the students, and within 2 minutes reading time it is tough to prepare the new station with the so much brilliant one. So but the 10 students which comes from the recall, there are only little twist is there. You have to find that twist, and you have to modify your answer according to the twist. And if you go good with the those 10 students stations, sorry, you can pass the examination, because
right.
passing mark is not so
Very
high,
high.
ma'am.
Yes, it is 62%.
Ha,
And if the station is new, it then even then see the domains like you will
ha.
be
Yes,
interested
ma'am.
in
Passing
information
is by
gathering.
domains also. I
So,
can communication. I
hmm,
can whether we can fail in the safety or applied chemical clinical knowledge.
yes, these
But
two
in
domains
terms
are
of
difficult.
yes, in terms of communication, if you see that we can talk, we can take a history in the history
Yes.
for pro forma, and that will
Exactly.
that will pass us three in communication with the patient, communication with the colleagues. That's it. That's yeah. But at that time, we cannot tell about the applied clinical knowledge, or we will also fail some with the safety point. But that doesn't
Yes.
matter. If you can go the 10 station good, I can assure you that you can pass.
Yes, yes. Many candidates told the same thing. And even from our experience, like if you have done 10 stations really very nicely, two
Yes, ma'am.
50-50, and two
Yes.
badly,
Mm.
still there are chances that you can pass the exam.
Yes, ma'am.
So,
That's yes.
like, be and what we always say that be thorough with the recalls. Like,
Yes, ma'am.
you will not be forgiven if you have missed any recall, because
Yes, ma'am. That's the main thing.
yes,
If
yes.
I did any wrong with recalls, that will be a bad thing.
Yes, exactly. Because the
And
thing
I
is,
would also like to tell that, don't go with the written talks too much. I'd also like to tell that beside going to the going through the recent talks, it is good to go through the guidelines.
yes, it talks actually, the RCOG is changing little bit, like this
Yes, ma'am.
peripartum
Yes, ma'am.
hyponatremia, the scenario came
Yeah.
because
But
there was a
one
clause.
station goes down. What does it matter? For one
Yeah.
station, I have to read 20 talks. But besides that, if I read
Mhm.
the guideline more accurately, I can
Mhm.
answer any twist.
Yes, yes, exactly. Yeah. And going through all the recalls, because that is what I have tried
Yes,
to
ma'am.
do, compiled all the recalls module wise and
Yes,
year
ma'am.
wise.
Yes, ma'am.
And
Recalls is we have to
mhm,
good grip over the recalls.
good grip,
I
exactly.
would like to tell that I would also like to tell my partners that if I wake you at 2 to 3 a.m. of night, and if I
Mhm.
ask you any question from recalls, you have to tell that instantly. Preparation
Exactly.
will be like that.
Yes, yes. You cannot miss the recalls, not at
We
any cost.
cannot miss that. If we
Mhm.
miss the recalls, there is no hope to pass.
Yes. Mhm. And
Because and the common guidelines and the newer guidelines, not
yes,
the guidelines which published 2 months before the exam. But the new
Usually,
that
the
that's
New
because
Year ones, yes, there will be scenarios from the New Year ones. Even the scientific impact paper, few the new
yes, ma'am.
ones,
Hmm.
like
Hmm.
this impacted fetal head and second stage cesarean section.
Hmm. Yes, ma'am. Hmm.
So something will be from the new guidelines. And like sometimes, like what I suggest that when you in your spare time, just keep reading the patient information leaflets also, because they are just 3 4 pages and you will finish
Yes, ma'am.
in no
Well,
time.
and well to do, and they are
Yes,
easily to digest, ma'am.
yes,
I
yes.
have all things in my. I not go well to do with laptop. I always handle my phone, and
Phone.
that
Yeah.
is easier for me, and
Yes.
that's helped me because your PDF is always with my phone. Because whenever in my
Okay.
journey,
Mhm.
when traveling by car,
Yes,
when I
yes.
waiting for my patient, when
Yeah.
in the operation theater room, I go through the
Okay. Yes, and I always
PDF.
say, don't just read the template, talk the template, talk, talk,
Yes, ma'am.
talk.
Yes, ma'am.
It helps. It
Yes.
helps because
Yes, ma'am.
when you're talking, that sound will ring in your ear, and I think that is more beneficial than just reading. Yes, reading is also okay, but
But
talking
we have to
is
talk, ma'am. Sometimes what happened, my driver asked me,
yes,
ma'am, did you say me something? I
yes,
told, don't you listen to me? You only drive.
yes.
I am
It
pagal women,
happens.
mad women. I all times doing hard work. You don't listen to me.
It
Because,
happens
ma'am,
when the exam is near.
yes, ma'am.
Yes, the
Uh,
practice, like everyone is in full swing, practicing and talking.
Yes, ma'am.
Yeah.
Only 10, 15 days before, uh, I have get rid of only 10 days before because that times
Mhm.
I think that if I go out of the country and that time I did the operation, any complication will happen, and that
Okay.
I will have to leave the country with
Yes,
that difficulties. And
yes.
for that reason, before 10 to 15 days, I only I will stop my practice
Yeah,
because
yeah.
at that time I.
That is very good because at
Hmm.
least if possible, get 2 weeks leave and
Yes, ma'am. I
or
will
at
take
least
two
one
weeks
week.
leave.
Yes.
Okay, yes, ma'am. Because
Mhm.
only to keep a peace of mind. Because you
Mhm.
know that that time there is a hurry. I think that because of my hurriness, I don't want to suffer my patient at the same
Mhm.
time. And
Mhm.
at the same time, I won't like to take any responsibilities of any patient. Because if any complication happen, it will also give me a pain. So I
Mhm.
stopped that because I want to leave the country with a peace mind,
Yes.
that there is I have not left behind any patient is suffering, anything is suffering, anyone is suffering from me, because you know that people come to us with their sufferings.
Yes.
Any if I talk to them a hard word, that will be also a what do you mean, that it also a curse to me because
Because the
they don't.
stress, I know stress
Yes,
of
ma'am.
exam is
Yes.
always
Hmm.
there. Even when
Yes,
you're on
ma'am.
duty, that stress is always there. So it's always
Yes,
a
ma'am.
good idea to
Hmm.
be off from the
Take
work,
a leave at least two
take
weeks.
the
At
leave
least 2 weeks.
2 weeks.
Yes. 2 weeks.
Because you
Only.
have
Huh.
travel, then you will be
Hmm.
preparing for some online and some
Hmm.
offline mocks. So and then you have to organize yourself in a better way. So yeah.
Ma'am, I would also like to tell you that if possible, I also know
Mhm.
that you are a busy woman. It
Mhm.
is possible to you for you to organize some online. You take our offline mock.
Mhm.
Yes, it is okay, but it is possible to take the online mock because you know that those who are, and I would also like to tell those person who are appearing
Online
for the.
mocks, I did arrange, but for few candidates because got really very busy in the end. As of now,
Yes, yes.
I'm not taking offline. I'm only like online. Yes, 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 yes. Online.
Yes, ma'am.
I'm
If you,
trying to.
sorry, ma'am, I have, if you take a offline mock, because I would like to tell my colleagues that
Yes,
before going for the examination, if you going for the first time, please attempt for a offline mock because
right.
real examination scenario is a different.
Yes, offline. I mean, it is important for those going for face-to-face exam. I totally
Yes, ma'am.
agree.
And for the first time,
Yes,
because ma'am, for
yes,
the second time,
for the
we have
first time.
gone through the
Mhm.
real scenario. That doesn't
Mhm.
matter to us this
Yes.
time. But for the first time, for who are going for the first time, please do attend the offline mock. It will be
Offline,
very
yes,
helpful.
on-site
Yes, ma'am.
mock. Yeah, that's
On
very helpful.
site mock. Yes.
Even we have done that. Exactly. I
Yes.
totally agree. because that will give you feel of the exam, how you're going from one cubicle to another cubicle.
Yes,
And
yes, yes.
like those 3 hours is really like a marathon.
Yes, ma'am. You know that the RCOG person who came
Hmm.
for the examination, he gave a speech before the exam. You know that, and
Hmm. They
one
will do
he
that.
said that this is the
Yeah.
fastest examination in your life.
Yes. They always say that it's going to be marathon, and these will be the like fastest, like your time will fly very fast.
Yes, ma'am.
This
My
three
last
hours
station was,
will pass
ma'am.
like anything.
Oh, that was the, I don't know my assist, ma'am. My last station. That's the intrauterine system. 35 years old woman. She has two kids.
Okay.
She does not want two kids at this moment. Money.
Okay.
That's the station is for the Mirana. And
Okay.
when this station, and I, when I doing that station, the station, I feel that the station was so good, and that was the
Hmm.
also lay examination examiner station, madam. There was four,
Right.
three examiner,
Yes, lay examiner
and,
also.
lay
Yeah.
examiner, and I and at the end of the examiner examination, they also smiled to me. Money, I
Okay.
I enjoyed my
Uh-huh.
station. I
Yes,
enjoyed my
yes.
station. Yes, ma'am.
Hmm.
And when they said that, when the bell rang, I go rush to another station.
Okay.
Then they said that it's over.
It's over, right? So after 14 stations, you were thinking there's another one, another scenario, because you were so much into the exam that
Ma'am.
you thought there is another 15th station also. Yes, yes.
And this
We can
is a
relate.
great experience. After passing the experience, I
Mhm.
relieved. I like to thank you, ma'am, that you give me the courage for giving for the second time. At first, I didn't think so that I won't go for that. It not will be doable for me, but you give
Mhm.
me that courage that, and you made me to do it. Thank you,
You
ma'am.
are also you also worked very hard, Dr. Sanjita, and you are an example for everyone who is going for the exam for the second and third time, because like you have to build up that courage. Going for the exam second time or third time is not easy at all. But yes, and this is only a matter of time, and trust in the process, trust in God's plan, and hopefully you all will do it.
Yes, ma'am.
Like you
Ma'am,
said,
I
if
would
you
also
can do
like to
it,
tell my
everyone else can do it.
Yes, ma'am. I will also like to tell my junior colleagues that
Yes,
as I am a age of 50 years, I can do this. You are younger than me. You can also do it.
yes,
Please
of
only
course.
keep faith on of you and on also your Almighty.
Yes,
That's
yes,
that.
yes.
Take the
Right.
prayer for the on behalf of the Muslim colleagues.
Hmm.
Please take your 5 waqt salah,
Yes, yes.
and on the other end, like me as Hindus, the Christians one, please pray.
Pray.
We have utilized our times with lots of things which you should not do. Takes
Yes,
only 10 minutes and pray
yes,
to God. And I also think that, Shabana,
yes,
if you ask God for anything by
yes,
heartedly,
yes,
God will
yes.
never disappoint you.
Exactly. Yes, yes. Work hard and pray hard.
Yes, ma'am.
Yes. And have full faith in God Almighty.
In God and on yourself.
Yes, exactly. On yourself.
This is the only thing, because you know that it is possible for a medical person to do anything. I know that medical person are the human being. They can
Mm-hmm.
do the hardest job in the world.
Mm-hmm. Yes, yes.
We are in the full of sleep. We are on, but when there is a call at the middle of night, we can rush to the call. We can attend the patient, and we are
Yes.
the gynecologists, are the
Attend
superwomen.
in the middle of the night and be and very alert. I
Yes,
mean,
ma'am.
with full concentration.
And full concentration, and we
Yes.
are the super women. I think that we are the super women. If at
Yes,
the
yes.
middle of the 3 a.m., if any patient
Mhm.
call us that I am in sufferings, we rush to the patient, we handle the patient with care, not for
Exactly.
the money, but for
Mhm.
the hour, to
Yeah.
support the women.
Yes, 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 exactly. Because
Yes,
patient
Mr.
always comes first. And
Yes, ma'am.
definitely passing this exam is make will make you a very good clinician and a very good human being as well.
Yes, ma'am. Yes, ma'am. I
Yes.
would also like to tell that, please, I will suggest Dr. Shabana as a mentor, because her course is well equipped, her PDF is well to do, and because her teaching module is so good,
Hmm.
so good, she covered it so much well. And because teaching module is the newer thing that we have to go for the first time in the
Yeah,
third part.
it is
Yes, and
very
I would
fast.
yeah, very
Mhm.
fast. And I'd also like to tell you that please go to the videos, and also try to buy a pelvis, a doll, some forceps, and every day please practice the proper station.
Exactly. If those who are going to the hospital or they are doing their own
Mm,
private
mm,
practice, they can
mm.
practice with the instruments and different
Yes.
type of forceps, the suture
Yes, ma'am.
material, everything.
Suture material, ma'am.
Yes, yes.
This
Mhm.
one day you can also go through the neonatal resuscitation, because these are the common thing
Exactly.
usually come.
Neonatal
And,
resuscitation came
and
this time.
and if you
Hmm.
want to keep it at the later time, it will also get a haphazard one. Please. Now you are, I think that at this moment you are little more disappointed. So go with the one forceps instruments, one not this one, and
Hmm.
this will make your hands swift, and this will not take you any extra time.
Extra time. Yes, yes.
Yes,
Practicing is very, very important. I mean, the
very, very, very
practicing
important.
the clinical skills and also practicing your stations, the
Yes, ma'am.
talking part is also
Yes,
important.
yes. You have
Yeah.
not to memorize. You
Hmm.
only plan it in your mind that yes, this is the station. I have to organize this, and
Hmm.
I have to present it in my own way. Huh,
Yes.
Dr.
Mhm.
Shabana's PDF will help us, because but every people has his own style how to present the station,
Yes.
and more time talk loudly. That will help us to speak more swiftly, more
Yes.
loudly, and more clearly. if
Right.
if you talk too much, then you can clear the station too early and you will
Mhm.
pass.
Yeah, exactly. Right. Okay, Dr. Sanchita.
Okay. Okay,
Thank
thank you,
you.
ma'am.
Thank you so
Thank you,
much.
ma'am.
Thank you so much for your time and for the
Okay,
valuable
okay, ma'am.
tips. And it was really nice to have you like in the group. And you have made us all very proud. And
Okay, thank you,
may
ma'am. We also
God,
a good mentor.
may Almighty
God
help
pray for
you.
you. Okay, okay, ma'am.
Yeah. Okay, my dear. Stay blessed
Okay, okay.
always, always.